There is no way that a primary care doctor in a 15-minute visit can even scratch the surface on everything. It is physically impossible. And so what does that very well-intentioned, beautifully trained PCP do? They triage and send. They prescribe them into drugs. They send them to a specialist. Oh, go see somebody for HRT. I wasn't trained in HRT. I don't know anything about IBS. Go see a GI. Oh, you've got high blood pressure and high cholesterol. Go see a cardiologist. Or here's 3 prescriptions, but I didn't explain why you're taking any of this stuff. And the cycle begins.
Welcome back to the Fitt Insider Podcast. I'm your host, Joe Veneri. Today I'm joined by Dr. Robin Berzin, founder and CEO of Parsley Health. In this episode, we discuss root cause medicine. Robin explains the company's holistic approach to optimizing well-being, plus we talk about delivering cost-effective outcomes and integrating with traditional healthcare. Let's get into it. Today's episode is brought to you by EGYM. EGYM provides fitness and health facilities with smart workout solutions built on its ecosystem of hardware, software, and partners. But it's more than cool tech. Their connected training experience delivers business results while helping members reach their wellness goals. If you run a gym, health club, YMCA, or any kind of fitness facility, you should check them out. Visit egym.com to learn more. Hi, Robin. Welcome to Fitt Insider. Thanks for joining us.
So great to be here. Thanks for having me.
Yeah, I'm excited to chat and a lot to get into, but I think to kick things off, can you introduce yourself and tell us about Parsley Health?
Sure. I'm Dr. Robin Berzin. I'm the founder and CEO of Parsley Health, based here in New York City. And Parsley's a national clinic for root cause medicine. We treat chronic disease patients and we help them get better and feel better faster through an approach to care called root cause medicine, where instead of band-aiding symptoms, we really work deeper to find and treat the root cause, giving people more sustainable solutions and long-term health.
Yeah, I want to dive into the root cause aspect. I think that's super important. Obviously, you touch on it right out of the gate. But one thing I wanted to talk about is just in terms of like business model, how would this differ from traditional healthcare for someone who's maybe not familiar?
So Parsley's, we're a virtual clinic, so we're a telehealth-based clinic. We're available in 50 states. We are also in brick and mortar clinics in New York City and Los Angeles. So we have a brick and mortar option as well, although most of our patients are fully virtual. And our business model is a combination of a program fee and fee for service for most of our customers. We have a direct to consumer line of business that's cash pay. We have a very quickly growing in network business. So we're in network with payers for over 10 million people so far and growing. And so we have fee for service contracts with payers and are in network. We also work with self-insured employers. And in a number of cases, self-insured employers are working with us and we're treating their employees. So same product, same great service, highly engaging, incredible outcomes, driving 32% reduction in total cost of care for a high cost population. But we deliver that for employers, for payers, and also for individuals who are looking for this kind of medicine across the country and just want to sign up.
Yeah, absolutely. Very diversified in terms of how you're going about doing that. I think there's probably a loaded question in any number of ways when you look at traditional healthcare and encountering, a number of obstacles for seeking care and especially across different demographics and you name it. But when you think of like a key insight as you came to Parsley Health and thinking like this needs to exist in the world, what is out there is broken. Is there one thing, is there kind of like an encapsulation of what that insight was that even got us going down this path?
For me, it was personal and it was also in my professional experience and my training in medicine that were like my two kind of aha moments. On the personal level, I was in my 20s suffering from cystic acne, and I saw dermatologists and I saw my primary care doctor and I saw all sorts of specialists and skincare people and used all these products. And I remember at one point they were injecting my zits with like cortisone shots with left scars. And I was just like, well, this isn't working. And I learned about an approach to health and an approach to medicine called functional medicine, which is all about figuring out why you have a condition and then treating that why instead of just treating the symptoms. And in learning about functional medicine, I learned that perhaps food allergies or food sensitivities were driving my acne. And I cut out two foods for about 3, 4 weeks, dairy and wheat. And my acne completely went away in like 3 or 4 weeks. No creams, no pills, no antibiotics, no hormone pill, medications. I had been prescribed all sorts of things. And I thought to myself, that's nuts. Like, why does our primary care, dermatology community, like, why does no one know this? Or why is no one sort of treating this, treating patients in this way? And I started learning about this kind of medicine and understanding that this way of treating the root cause applied not just to acne or, psoriasis or atopic dermatitis or other skin conditions, but it applied to diabetes and it applied to migraine headaches and it applied to autoimmune diseases like Crohn's and ulcerative colitis. And so I got really interested in that on a personal level. And then when I was in my training at Columbia, is where I went to medical school, Mount Sinai Hospital, I trained in internal medicine. At both places, what I observed is that we have all of these patients who are living with chronic conditions that last years, if not decades. And these are the conditions that are driving 90% of our healthcare costs, right? And yet our healthcare system didn't seem to be designed to really help these people get better. It seemed to be just sort of perpetuating the problem. Certainly not intentionally. I don't mean to say that anyone was intentionally perpetuating a problem, but it was sort of like there was this revolving door between primary care and specialty care. And I watched these patients bounce back and forth from primary care to specialty care when a lot of them, the people with diabetes and heart disease and depression and autoimmune disease and skin conditions like the one I had, actually had conditions that could get better. But no one was helping them get better. We were managing the disease. And so that felt to me like this massive aha moment that combined with my personal experience with functional medicine and then my professional training and the observations I had there, I said, how do we bring a different kind of approach that's more adept at solving these types of chronic conditions to mass scale? And those two experiences sort of put together, if you will, helped me start Parsley Health. I had already co-founded one digital health company during med school, so I had some experience building software for the healthcare system in my first startup. And so I would throw in a little bit of tech and a little bit of startup experience to that like cauldron of experiences. And together, those things led me to say, how do we bring this medicine to scale? Because it is so much more effective than the way that we're doing things otherwise.
Hearing you talk about it, and I think a lot of listeners, both founders who are building digital health and wellness companies, but also just individuals who have had these challenges themselves when they try to seek out treatment and care. It's like very logical. They're again nodding their head. But the idea of root cause medicine and functional medicine is not the standard protocol. It's unfortunately kind of in some ways in opposition to it. You mentioned it's not necessarily intentional and there are a lot of well-meaning people and organizations, but have you encountered resistance in trying to implement this? And why is that the case that this has to be almost building an entirely new system or path to care, to work around the existing system that we have?
What's great is actually that we work within the existing system. And I want to clarify something. Root cause medicine is in no way in opposition to medicine as we practice it today. All of our providers at Parsley Health are board certified internal medicine, family medicine providers, nurses, doctors, NPs, PAs. We are all using all of the tools in the medicine that we trained in. So we prescribe drugs at Parsley Health. We refer to specialists at Parsley Health. We order imaging at Parsley Health. We close gaps in care like mammograms and colonoscopies at Parsley Health. But the added layer is that we've built our own fellowship at Parsley, a certification program in root cause medicine. And we train all of our providers in root cause medicine on top of their training. So think of it as an and, not an or. And we have a medical program that we're able to offer, and we offer it within the constructs of how our healthcare system works today. So we bill existing CPT codes. We work with employers and payers and really work within the existing system. And think of root cause medicine not as an opposition, but as an add to our existing healthcare system. Primary care is doing a great job for about 70% of commercially insured people. It's doing great. For about 30% of those people, 30% of the commercial workforce today, and that's about 155, 160 million people, 30% of that workforce has not one but two or more chronic conditions today. And that group of people costs about 20 grand a year versus the average commercially insured, which is closer to 6. And the cost trend on that group is much higher. When you look at employer data, when you look at market scan data, we've been working with payers who've shared their data with us. The cost trend rise on that population is much faster for those folks and their families. And so the question is, primary care is working really well, specialty care is working really well, but there's a missing piece. There's a gap for these folks who have chronic conditions or chronic symptoms that nobody can figure out. Those are the people who are staying sick that could get better. And what we've done in recent times is we've sort of thrown a bunch of point solutions at those people. Well, here's a GI thing, and here's a specialized testing startup, and here's a food as medicine, and now there's an autoimmune, and now there's a diabetes coach and an app, right? We've fragmented their experience even further. And what people in that category need is not more care coordination, is not 7 places for 7 different conditions and symptoms to go. They need one doctor who has additional training in finding and treating the root cause to help turn the tide and help them get better. I'll give you a simple example, different from my acne example. Somebody who, and I see patients on Thursday mornings at Parsley, so I'm still part of the care team in addition to being our founder and CEO. And I'll see a patient, a woman in her, she's 50 years old, and she's got irritable bowel syndrome. She's got depression. She's in menopause and needs hormone replacement therapy. She needs a colonoscopy because she hasn't, she's delayed and hasn't gotten one. She has high blood pressure and high cholesterol and weight gain. I think I just named 7 or 8 conditions and symptoms that this individual has. This person is a classic American, by the way. She's working, she's highly functional, she's in the workforce, she's not like bedbound at home, but she's got so much going on. She does not need 8 different doctors, and she actually doesn't need a specialist. In one visit with her in 30 minutes, I prescribed hormone replacement therapy for her menopausal symptoms, which were really disrupting her life, ordered a test to diagnose the root cause of her irritable bowel syndrome so that we could treat it. Often it's caused by a condition called small intestinal bacterial overgrowth. I helped her switch to a new antidepressant because the one that she had been taking really wasn't working for her, and also worked with her on diet and lifestyle change because her high cholesterol and her metabolic syndrome are really driven by her diet. And she doesn't, at this point, really need a medication, right? She needs a chance and highly specific directions on how to eat and move differently to sort of move the needle on these numbers. And because she's working with me over time, I'm going to see her again. So I don't need to dump 30 prescriptions in her lap and send her out the door and hope she fills them, which the data shows that 50% of drugs we prescribe are never even filled at the pharmacy, which is a crazy, scary stat to me as a physician. She needs somebody to help her really work through what she's dealing with and give her the right intervention and the right time. And some of that might be a change in diet. Some of it might be a drug. Some of it is ordering the right test. And I'm able to do that because I'm trained in root cause medicine. And so I'm trained to think of the body as an ecosystem. I understand how the gut impacts the brain, impacts the skin, impacts the metabolism. And that extra training allows me to manage more of these conditions with one provider in one place. And you might say, well, how is that different than primary care? Isn't primary care supposed to do all that? Well, there is no way that a primary care doctor in a 15-minute visit can even scratch the surface on everything I just said. It is physically impossible. And so what does that very well-intentioned, beautifully trained PCP do? They triage and send. They prescribe a bunch of drugs. They send them to a specialist. Oh, go see somebody for HRT. I wasn't trained in HRT. I don't know anything about IBS. Go see a GI. Oh, you've got high blood pressure and high cholesterol. Go see a cardiologist. Or here's 3 prescriptions, but I didn't explain why you're taking any of this stuff. And the cycle begins, right? Whereas in a root cause medicine context, I can manage all of those things in one place in a holistic way that's so much more supportive for that patient and massively cost savings. Now, does every person need that? No. If you're, I don't know, 27 and wildly healthy and just need your annual checkup, you're good. Go see your PCP. You don't need Parsley Health. At least not the way we work today, right? But we're working with folks that have 80% of our members have 2 plus comorbidities, 60% have 3 or 4, and companies, really large self-insured employers, major national health plans are coming to us saying the point solutions haven't worked. Our specialist networks are good and our primary care networks are good. We might even have advanced primary care, but no one is actually trained as an expert in helping people with chronic diseases gets better. And that is Parsley.
The Fitt Insider Podcast is brought to you by our friends at EGYM. This is an exciting partnership for us, and not just because EGYM makes some of the most innovative fitness products out there, but because the entire EGYM team, led by their CEO Philip, is committed to making health, fitness, and well-being more accessible for everyone. And that's a mission we can get behind. By combining their smart equipment with integrated software and hundreds of connected partner brands, EGYM helps fitness facilities stand out by delivering a personalized, gamified workout experience that improves outcomes and member engagement. So if you're a gym or health club operator thinking about how to best serve your members while driving business results, go see what EGYM is up to at egym.com. The idea of and not or is very important. And I appreciate you kind of breaking that down and giving the example of what that might actually look like in practice. I think it's something that maybe a lot of companies set out to reach that place where, well, let's break it maybe into two. There's a lot of kind of new age upstarts that are down the path of like membership based primary care that are positioned as like very elite, somewhat of like an exclusive kind of membership club, albeit focused on health optimization, longevity, lots of things like that. And then there's other ones that say, hey, we're going to reinvent primary care in some way. And maybe that's around functional medicine and maybe that's around the root cause. But they don't ever get to this place where they're able to integrate and work within the existing healthcare system. It tends to be like out of pocket and continuing to be maybe a bit of a luxury. How are you able to navigate that place to say, like, yes, we can integrate with the healthcare system and insurers and plans and employers in a way that like makes this accessible?
That was really my dream when I started Parsley. I observed that this kind of medicine existed, but that it was existed in a really inaccessible way, right? It was wildly expensive. I trained and worked in a couple of the top private practices with some of the top doctors and leaders in this field. And I'm so grateful for that experience. But, they were charging thousands of dollars just for a visit, right? And the testing costs were exorbitant and there was over supplementation. And I looked at that world and I said, there's so much good here in how we're thinking about finding and treating the root cause. And yet there's not such great standards of care. Not everything has an evidence base. A lot of this is happening in private practices where it's really expensive. How do we fix all that and build a new version of root cause medicine for this century, for our future, that is moving into a value-based world, that is accessible at its price point, that is covered by insurance? And I'm really proud to say that Parsley Health is the first ever root cause medicine clinic, one, to be national, two, to have published outcomes data, and three, to work with payers and employers and to be at scale. And the way that we've done that is leveraging technology to make our operations more streamlined and effective, leveraging nurses and health coaches who are part of our care team so that we're leveraging our medical providers where they're most needed, building our own training program so that we can take any MD and PA who's already board certified, right? We're not training them how to be a provider. Well, we train them ourselves in our own in-house certification program in root cause medicine. That's hugely helpful. Being telehealth based, so we don't have the brick and mortar component. And then being able to really, and I think this is sort of the key thing, I mentioned it already, but it bears sort of going into, is really focused on outcomes data to justify being paid at rates that recognize the work that we're doing, right? This isn't a 15-minute PCP visit. We are not a PCP. There are many PCPs out there who are doing a phenomenal job. Many of them are overburdened, frankly, and could use a partner like us to refer to, and we can refer back to them on the ground for these patients who are those, what is said in medicine sometimes, the frequent flyers, the folks have too much going on, the folks that you send to a specialist, but the specialist can't see them for 3, 6, 9 months. What do you do? Parsley is that care team and that model. And we're able to bill at, rates that are justified because of the outcomes data we have showing that this medicine really works.
Yeah, can we talk a little bit more about that in terms of measuring and demonstrating both the cost effectiveness and also the health outcomes? What does that look like, and what was that process like of maybe going from not having it initially and maybe being more out of pocket to now transitioning into something where you're more integrated into the healthcare system?
So, we started direct to consumer, as I mentioned, and my view was always get the data and then start working with the healthcare system. And so, even when we had no data, because we were really new, we had a PhD in data science working with us. And we actually followed FDA guidelines and built our own root cause medicine PROM, patient reported outcomes measure. NIH Promise 10 is another example that's out there. We built one to look at whole body symptoms holistically in an ambulatory population in a way that would allow us to track symptom severity over time in a validated way. We built it. We got a tremendous data set on it. We published it multiple times. We validated it. It's one of the outcomes that we track. And then as we amassed data sets of tens of thousands of patients, we then worked with an independent actuarial firm to deep dive through that data and to analyze it to show were we driving cost savings. And I'm really proud of that work. A lot of companies do that D2C, B2B transition really early. I see most digital health companies and sort of healthcare companies, new wave healthcare companies, they're kind of like D2C for 6 to 12 months. They get a minuscule data set. They aren't really successful in D2C because it's not fundamentally a product that the individual really wants. It's sort of more intended to serve the system. And then they quickly pivot to B2B and start selling that way. But the data is not based on real patient care experience. It's based on a very small data set or a very early data set. We sort of had the opposite problem. We probably spent longer than I don't know if we should have or needed to in D2C because it worked so well. And we grew to 8 figures in revenue in D2C and like had just tremendous desperation almost, people flying into our centers before this was before COVID in New York and LA from other city states and countries to get access to this type of care. Because as I mentioned earlier, we were at such an affordable price point compared to where this kind of medicine was elsewhere. And we got a really robust data set and a lot of reps, if you will, in just treating patients and delivering care to these complex patients, both in person and fully virtually. And so I think then by the time we went into starting to work with payers and employers, which has really just been for us in the past 2 years, the robustness of that analysis and that data set was quite strong. And I'm really glad for that. So, hindsight is 2020. Should we have worked with the payers sooner? I don't know the answer. I will never know the answer. I'm not going to A/B test this company and do it all over again. There's one Parsley Health. But in learning, I think that thinking originally was right. Try to get really good and solid outcomes data and then use that to use it to show the healthcare system that, hey, this kind of medicine might be a little different or a little new to you. But not only does it just make sense, it's got really strong data backing it up. And I think that's been helpful.
Yeah, it's something I've heard other founders in the space kind of talk about is like, be so good they can't ignore you. It's like you can't go maybe from day one and say, hey, this is what we're doing and this is why you should partner with us and work with us. But it's like once you accumulate that data, those outcomes, those proof points, it's like they can't deny the fact that like you're doing this work, people want it, it's working. So then you get a little bit of the leverage in that relationship.
Yeah, I mean, I wouldn't say that we have leverage, but, I would say that we're confident in our ability to deliver great patient care, in our ability to deliver outcomes, and in our understanding of the value of this form of medicine. And what's really cool to me, last summer, I can't believe it's been about a year, we actually had inbound from one of the biggest payers in the country, and they said, we're looking for functional root cause medicine, and you all are the only scaled solution. And we said, I basically almost fell out of my chair. I thought it would take like years to hear that. And we said, well, why are you looking for this? Why are you looking for a solution in this space? And from meeting many people in that organization at this point, many of them said, you hear all the time the stories of how this kind of medicine just changed someone's life. Everyone has a story. My aunt, my sister, my dad, my grandmother, my husband, myself. And you can't deny it anymore. And the consumer demand for this is very, very real. Like, this is not going anywhere. And
Right.
so someone's going to scale it, and we think it should be us. And we were like, well, we're here. We've built this thing. We've been doing this for a while. And so I thought that was really interesting and really exciting, because I think it shows that ultimately our healthcare system, our payers, our employers, and all of us who are patients want it to be better, and we want solutions that work, and we'll keep going until we find them.
Yeah, it kind of aligns with a question I wanted to ask you, which is basically like, how do you see the role of traditional healthcare? We're talking about like basically startups, technology companies, like coming and trying to whether integrate or work within or create something new and just move things along in terms of health outcomes and increasing access to care. But then you're kind of talking, well, they came to us in a way and said, hey, how can we work together? How do you see the traditional healthcare evolving as companies like Parsley gain traction? Them being more open to it or rethinking these types of partnerships and maybe even within the experiences you've had.
Yeah, you know what I mean? I think we see it happening all the time. You know what I mean? Like, I think we're seeing in the trends and tailwinds around value-based care, new payment models, and the system recognizing that the way that we pay for care matters, and that the way we pay for care is a tool and a lever that we can use to drive better outcomes, and not just better outcomes, but different experiences. And I think you're seeing that everywhere. And of course, a lot of that has happened in Medicare and in Medicare Advantage, and that was sort of the first wave of it. But what I think is really cool now, we have 3 value-based pilots and programs going forward this year with 3 different payers, for the care we offer. And I think that shows that, and we're mainly in the commercial segment today. So we are not currently working in Medicare or Medicaid largely. And so I think that's really exciting, because I think in some ways it's a wild west, but in other ways that means there's flexibility, because I see everyone sort of trying to figure out together, what does value-based care even mean in commercial? I mean, I think a lot of people say it's hard to do or it can't be done. And I think it is hard, but it's not that it can't be done. It's just that it's going to have to look different than it looks in Medicare. It just can't be a rinse and repeat of that model. And right now we're seeing how that model, as it's matured, is hitting some walls. I think the whole Medicare Advantage program is sort of in what I call its awkward teenage years, right? It's growing up and it's getting pressure tested a little bit, and it's going to have to evolve from its, V1. That's okay. That's what happens. But I think you're seeing that more in commercial, and I think that, technology at large is forcing, in a good way, healthcare to change. You and I, you have an Android or an iPhone. I'm assuming you are using that to do most of your daily activities, whether it's shopping or communicating or working. And all of these tools that we have just as general consumers can't help but deeply influence the way that we practice medicine and the way that we deliver care. AI, big data and analytics, all of these things are changing healthcare. And yes, it's slower in healthcare, but you also can't wall healthcare off, because eventually, at the end of the day, healthcare is about people. And if we're all using these tools, and as doctors, we're all using these tools in our daily lives, we can't like not use them at work. That's just weird.
Yeah, maybe a couple more questions before we get you out of here. One, you mentioned not A/B testing the company is kind of like Parsley Health is what it is, and in this case for better. But as you look at the experience to date, have there been unexpected challenges or pivots that maybe changed the trajectory or direction that you were on? I think obviously, as I'm saying that, one comes to mind, obviously like COVID, right? Disrupted everybody's everything. But whether that's the main one or there are other ones that said, wow, this really shifted what we were doing and set us off on a different path.
I always say to our team, that the why at Parsley has never changed, meaning our mission is to bring the world's best possible medicine to everyone everywhere. And yet the how changes all the time. And the how for us shouldn't ever be sacred, because if we're not changing how we do things, and how could mean who we're selling to, it could mean delivering care via telehealth, it could mean offering new variants of our product and service in a way that allows us to reach more people. Those hows are not sacred. We should always be changing them. If we're not changing those things, we're dead, right? So Parsley's changed a lot, from our original inception, where we were a hybrid in person and telehealth from day one. We were cash pay in our early days, so it didn't matter that there wasn't telehealth parity before COVID. Our patients were doing telehealth all the time. And that actually really helped us as COVID happened. We had actually seen in the year or two prior, in early days of the company, like 2018, 2019 were like the earliest days of the company. And we had seen that a lot of our patients were just doing virtual care for almost for everything. And those people were like flying to find us, doing that in-person visit in New York or LA, and then doing everything virtually from there. And we were like, okay, maybe we don't need brick and mortar. And so literally February of 2020, and the company was tiny at this point. We launched like 6 or 8 states for fully virtual care. And we had no idea at that time how to market outside of New York and LA. Like we didn't really know what we were doing from a growth standpoint. It was really just a beta test. And then COVID happened. And the thing that really saved us in that first year was that, a lot of medical services, their utilization went to zero overnight. But because we had a recurring revenue membership model, and because our patients were so used to doing telehealth, even the New York and LA folks were so used to doing telehealth, and our providers were so used to doing telehealth, that we just moved it all to telehealth overnight. And it was like no one skipped a beat. So we didn't have any retention issues. We didn't have anyone stop using Parsley. That was a huge win. And then the normalization of telehealth for the industry then was huge for us, because we went from, I forget if it was 6 or 8 states in early 2020, but then, now we're 50 state telehealth. There's telehealth parity, and we are in network now, and we are working with the payers now. So that actually does really matter for us, today. That was one big change. I think the other big change has been in the past 2 years. We were 100% direct to consumer go to market in the first like 4 years of the company. And over the past 2 years, we've added payer and employer go to markets quite successfully. But that was a massive learning curve. New team, new executives, sales teams that never existed before, client success, account management, revenue cycle management, like literally things that the company 2 years ago just did not have, are now like core pieces of our business. And probably the hardest but best thing about where we are today is we're sort of now in a bit more of a like a good groove, where we're balancing direct to consumer and marketing in that vein of our company with a growing enterprise business. And in the beginning, we didn't know how to sort of balance those two things together. And now I think we've started to figure it out. I wouldn't say we've figured everything out, but it's like feeling much more gelled.
You talked a little bit about it there, this idea of, obviously embracing technology in general across healthcare, and then the kind of telehealth parity and shifting to that, where it's like basically everybody to some extent expects that. And if not, most people seek it out. At this point, do you have a sense of the next paradigm shift, if it is quote unquote next, or kind of where things continue to evolve when you think about healthcare delivery or patient care?
I wish I had a crystal ball. And I'm also perfectly willing to make predictions that I think will end up being wrong. But I certainly think AI is going to play a role. I don't think it's going to play a role anytime soon in the way that often gets popularized, which is like, now you have this AI doctor or nurse who you talk to all the time, and you have a relationship, and it's like that movie Her, and it's your doctor in a bot. I actually think it's going to be much less exciting, but deeply important pieces of healthcare that get transformed by AI, everything from billing, workflow automation. Let's just take closing gaps in care, right? It sounds like a simple problem. Has this person had a mammogram or not? Have they had a colonoscopy or not? Life-saving preventive screenings. And the answer is like, we do not anywhere have a great way of knowing systematically like where people are in that journey and if they got the results. And based on those results, which are often faxed in a PDF from a specialist somewhere, does this person need to get another colonoscopy in 2 years, 5 years, 10 years? Like, where are they? AI, I think, has a power to like solve that problem, which is a very sort of thorny and frustrating data problem, but is very solvable but with AI. And billions and billions of dollars and many, many lives will be impacted positively if we could just like solve that type of problem with AI. I don't think we need to replace the doctor yet. I think we have these other bigger problems where our doctors are so burdened with, and when I say doctor, I mean all medical providers. I think our providers are so burdened or overburdened with admin and data entry and tracking that sort of stuff. Everyone complains in healthcare, our costs are going up and our provider base is so costly. And we have a massive provider shortage. We don't even have enough of these folks for the population that we have. I think AI can be a solve, I hope, in how we use their time. Because if we do have this finite resource of trained medical personnel, we need to get better at using their time for what it's best and meant to be used for.
Yeah, a massive opportunity. I think we're all kind of waiting to see how that plays out and then adapt accordingly when the time is right. And I think in wrapping up, where would you point them to learn more? Is the website, social? Where's the best place to go?
Yeah, parsleyhealth.com. And you can follow Parsley Health on Instagram and on Facebook, on Twitter. Sorry, X. I'll never be able to say X. I don't know who can say that out loud. It's like just never going to roll off the tongue, but I'll try. And we have an incredible newsletter at Parsley. It's a free newsletter. It's really, and also a great blog. We get millions of visitors to our blog every year. And really deep dive content on all of the types of different medical conditions and health topics that we've talked about and touched on a little bit today: autoimmune and GI and mental health and heart health and metabolic health. We cover all of that. So it's a really great resource just for anyone listening who's an individual who's trying to learn more about not just root cause medicine, but just their own body and their own health and how they might improve that. And then I also personally have a website, robinberzinmd.com, and I also have a newsletter. I do a newsletter on every 2 weeks or so, and I've done deep dives on topics like hormone replacement therapy used preventively. My newsletter came out this morning. I did my take on peptides, why they were banned, how they're being used. So that's another place, robinberzinmd.com. And you can also follow me on Instagram and so forth.
Fantastic. Yeah, lots of great resources. We'll have everything linked up in the show notes, and just very grateful for the time today. Thanks for being here.
Thanks so much.
Thanks for listening to today's episode. If you got value from the conversation, please consider subscribing and sharing the podcast with a friend or colleague. It's a massive help. And if you want more content like this, including news and insights on the latest industry developments, subscribe to the Fitt Insider newsletter at insider.fitt.co. And one more thing, you can learn more about our recruiting and consulting services at fitt.co. That's fitt.co. I'll see you here next week.